I'm Dr. Di Lawrence, Chief Medical Officer at Sarlan and clinician paediatrician. We've got a really proud history at Sarlan of true co-design and partnering with our consumers. We're really proud of that, and this is really the next phase in the maturity of that. So it's how do we actually have the time and the opportunity to really listen to our patients and actually ask them what matters to you, taking into account their values and their beliefs and what is most important to them. We want to do that in a way that's respectful and, importantly, culturally safe.
The first step in translating patients' preferences into action is checking with the patient that what I understood is really what they were trying to tell me. So perhaps reflecting to them of what we collectively have agreed to, of what the key priorities with them might be. So if I'm by the bedside or in the consultation room, I might repeat and say, so perhaps does that mean that we've agreed that this is what we're going to do? That will be the first point of action. Is that what I understood? And from there onwards, the important part is making sure that everybody who is a member of the clinical team understands the same information. So very often, if I am leading the ward round, I might want to make sure that everybody in the ward knows what the plan is. So members of the nursing staff, allied health professionals, and then that plan is documented, and there is a point where plan might be revised with the patient again. So everybody's on the same page and everybody knows that the general direction of what we're trying to do has got some specific steps underneath it that we'll be taking and revisiting on a regular basis.
I think it's firstly important to have a clear and shared understanding of what those goals are. And to do this, I sometimes like to write those goals down on a piece of paper. One of the tools that we've introduced is the neonatal unit goals of care sheet. And this sheet allows collectively ourselves and the parents to write down the goals for the week and also to modify those and tweak them each day on the ward round. There's areas on the sheet for parents to feedback about how they're feeling, about how we're travelling with the goals. And there's also a pictogram on the sheet, which is a pictogram of the patient journey, where key achievements along the pathway are highlighted by stepping stones, and this gives the parents a sense of optimism and achievement as they move towards the ultimate goal, which is going home.
I think it's really important to be open and honest with the conversations that you're having with patients, because the whole process is about a shared decision making. Patients need to have goals that they can reasonably achieve in the timeframes that they're with you in their care journey. And so sometimes we need to take a step back and break them down. Doesn't mean we're changing their goals for them, but we're helping them or facilitating a step in that goal process and reflecting on that with them. I think there's a perception that the time taken to have these conversations could be a barrier, but realistically we know that the evidence supports that the investment of time to get these conversations right and to have a true shared understanding of goals of care is an investment in the healthcare journey. It will lead itself to efficiencies throughout the continuum of the patient's care. This is about having true shared decision making with our patients and having a patient experience as the centre of everything we do. We want to see Sarlan as leading the way of having a culture of safety and patient-centred care.
So if we're talking to a patient on ward rounds and someone says that something matters to them, I guess we would try and explore that and find out what they mean by that. If something that's quite personal to them is something more from home, then we would try and talk to family members and see if any family members might be able to assist in being able to complete that task or settle whatever issue it is. If it's something that's more hospitalized oriented, then we would try and assist with that. So we might ask them if it's something to do with the mobility, and we can refer to the physios or other allied health professionals, or we might need to refer to another medical team if it's another medical condition. Sometimes it might be something more for comfort, and we can try and get them a blanket or assist with getting them a drink or helping them feed or change their position.
As an allied health professional, we find these conversations really helpful, as sometimes the patients may not express all their needs to one particular person, so it's really good to have that open communication so that we can identify needs from medical, from the patient, and if there's any medications which might actually be impacting our ability to get patients up and mobilise them, we can have that open communication with you guys as well as with patients and families, which is really helpful. And
yeah, to me as a pharmacist, it's very important that patients knows what medications they are on. Sometimes they do have a question, they give me these white little tablet in the morning, so address any concerns or issues they might have, and also feeling part of a team. This is a multidisciplinary team, so it's good for team building as well.
Once you've got that communication with the patient, and then you take it to your team members, and that's how you get what the patient wants and get the best for the patient every single time.
It makes the world of difference. It absolutely does. Taking the time to listen to what's important to that patient, what matters to them. What matters to one person isn't necessarily what matters to another person. Just be yourself and be friendly. Just take care.